I'm Dr. Angie Stoehr, and this is Feminine Curiosities. It is Cervical Health Month, so we are going to talk about your cervix. The cervix is the bottom of the uterus. So the uterus is inside the abdomen, and then at the top of the vagina, it comes down into the vagina. That's your cervix. It's what dilates when you go to have a baby. The cervix is kind of an interesting organ because it can dilate and contract, but it's also made up of several different types of tissue. Where the inside of the cervix becomes the outside of the cervix is kind of like where the inside of your face becomes the outside, or the outside of your face becomes the inside of your mouth. So there's lips there. Those lips are called the transition zone. That transition zone is where we check pap smears. So pap smears are to look for cervical cancer. That's really all pap smears are good for. Now, cervical cancer, 99.8% approximately, is caused by a virus. That virus is called HPV, or human papillomavirus. Human papillomavirus is a sexually transmitted infection. It can be cleared by the body like a common cold, or sometimes it hangs around. When it hangs around, it can cause the cells to grow more frequently. And when your cervix cells start replicating more frequently, that can develop into cervical cancer. Now, there are different degrees of abnormalities on pap smears. They go from normal all the way up to cancer. And in the middle there's several different variations. All of those different variations are slightly more and more concerning. Depending on where you fall into that range and your age of a pap smear, you may be asked to do something called a colposcopy. Now, a colposcope is really just a glorified microscope. I have one right here. This is a colposcope. This is the side that goes towards you where the cervix is, and this is the side that we look in, kind of like the back side of a microscope, which is really kind of what this is. It does have a couple of fancy buttons on it though that we can use to change color and to zoom in. What we're looking with a colposcopy is to see where the abnormal cells go into the cervix and how deep they are. If those abnormal cells from your pap smear are just floating around on the surface, that's not particularly concerning. We can just keep an eye on it. If those abnormal cells are going deeper into the cervix, towards something called the basement membrane, then we start getting worried that this could develop into cervical cancer in a quicker time format than we would like, in which case we proceed to another procedure called a LEEP. The LEEP basically is just a bigger biopsy that's typically done under sedation, where we remove the entire lips or where the abnormal cells are growing in the cervix. If you guys have any questions about pap smears or colposcopies, please do let me know. Little message down below. Give me a like. Pass me off to all of your friends.